I'm recording this video with a sequence of exercises that you can follow through for those of you who have issues with your low back, with your knees, or really the whole posture. So first, you're going to come onto your hands and knees and make sure that the hands are right below your shoulders and that the knees are right below your hips. This is called the cat and camel. So as you inhale, I want you to drop your pelvis down and belly soft down as you arch your back and gaze up. And then as you exhale, tuck your tail under. Really utilize the core musculature to really round the back. And as you do that, I want you to firmly press down through the palms of your hands. You should feel nice activation of your core here. And then you're going to go ahead and inhale up and pull up and out. And exhale. And inhale. And exhale. So what I see in my clinic a lot, my patients can't, if this is the first time you've ever done this, they tend to shift and sway and do all kinds of things. So remember that your hands are planted underneath your shoulders and that the knees are right under your hips, that you're making like a box. And those 4 points are bearing the weight for you. All you're moving really is an extension of the spine and then really a deep flexion of the spine, so much so that you're really engaging the core to really stretch the back, like rounding. And really, most important thing for you to remember is to really tuck that tail under as you breathe out. And one more like that. And exhale. I'll just repeat one more. Inhale. And exhale. Good. Remember, you can make it as hard as you want or you can make it as easy as you want. The key thing is to really make sure that you feel your core engaging. This next one is really, really great for those of you who are sitting in the desk or doing office work all day. So first, you're sitting up nice and tall, making sure that the spine is perpendicular to whatever surface you're sitting on. You're going to go ahead and bring the right ankle on top of the left knee. Bring the toes close to, or flex your toes towards your shin. Sitting up nice and tall. What I see oftentimes when I ask my patients to do this is that they hunch over like this, right? So you're losing flexibility in the hips. So I want you to pull up and out of your pelvis, sitting up nice and tall. And for most of you, this might be just enough stretch for you. For those of you who have a little bit more range, I want you to gently push forward and you should feel a nice deep stretch from the low back all the way down to the outside of your thigh and the leg. And if you feel it somewhere kind of restricting and you don't feel it much in the hip but somewhere else, that's fine too. The idea is to just get in the habit of kind of stretching the whole sciatic nerve, pathway, so that you're really stretching the myofascial layers there and getting enough flexibility. And just hold for about 30 seconds. And I start to really feel it into my hip now. So give it a few minutes or a few seconds for those of you who are like thinking that you're not getting a real stretch. But again, most of you, just sitting up like this will be a challenge, right? And then you're going to switch. I'm going to bring my left ankle on top of the right knee, bringing my toes up toward my shin. This is my tight hip. So I feel it already in this position. So I'm going to pull up and out and really go forward. Ooh, and it's almost a very severe stretch that I feel on the outside of my thigh into my hip. And I'm just going to just breathe in and out. Breathe in and out. And making sure, again, that you're not hunching forward, that you're not rounding your back, but you're pulling up and out of your pelvis, keeping this nice broad shoulders, maintaining that perfect posture, upright posture. and breathe. And come back gently. And that's your piriformis stretch. This next one you're going to do with your bare feet, wherever. It can be on a carpet surface. Just make sure that it's on a firm surface to where it's not going to challenge your balance too much. Because what you're going to do is feet shoulder width apart, and then you're going to gently bring your heels all the way up. And then as you go slowly down, you're going to go slowly down, control all the way down. Most of you, when you first start out, you're going to just collapse down like that. But the idea is to really resist that gravity pull and control the descent, right? So I'm going to show you a side profile just so you understand. I really need you to bend at the base of your toes. So come high, look at my feet, come high up on your toes, and then gently you're going to go straight down, nice and slow. Really pull the core, belly to the spine, and with control go up, and with control you're going to come down. Those of you who feel like you need something to hold on to, don't rely on the wall so much, but gently place just a little finger there, and that's going to be enough of a support for most of you, right? Just the whole idea of having something, but don't use that as a crutch. And my patients asked if they can have their arms out here, and certainly you can do that, because that's going to give you a little bit more better control as far as the balance goes. So that's the heel raises. Try to do 10 times every day. This next one is partial squats. This is a very powerful little exercise. So I want you to stand with feet shoulder width apart and try to bring more weight towards the heels of your feet. So gently lift the toes up, right? And then go ahead and sink your hips down, but as you do that, be very conscientious of the fact that your knees need to stay behind your toes, right? And I want to show you my low back here. A lot of you either bring your upper body all the way down, or you're up here but you're arching your back so much so that you're hyper arching with your low back. So from here I want you to gently tuck your tail slightly under, and that's going to cause you to work your thighs a little bit more, right? You're going to go down and up, nice and slow, against gravity. Nicely slowly down and up, keeping a nice gentle tuck of your tailbone and up. It's going to really challenge your balance. So I feel free to have sort of your hands near the wall. Those of you who feel a little bit challenged, go down and up, nice and slow, down and up. Again, knees stay behind your toes. That's very important. Tuck your tail slightly under. And this time we're going to stay down. Let me just show you, those of you who can, your low back only, or your pelvis, is going to just tuck in and out. Tuck down and out. This is going to feel like a nice gentle tug and a pull in the low back. Exhale down and inhale up. Exhale down and inhale up. Exhale down and inhale up. And slowly come up. Good job. This next exercise is going to really help you to strengthen your hip flexors, which is something that you need as you grow older. When you walk, you're not going to be able to clear your foot, and oftentimes my patients trip over their own feet. So you'd be surprised how challenging this exercise can be. So standing with 2 feet on the floor, you're going to gently lift your right leg up, and this is going to really challenge your balance as well as your flexibility. If you've got tight hamstrings, this is going to really be taxing. You're not going to be able to reach your leg up as high, and that's fine. So sit up or stand up nice and tall. You're going to open your chest, really get the core to engage, proper posture, and then gently lift your leg up, and then gently place it down, right? So what happens is, a lot of the times when I ask them to lift their legs, my patients, if they don't have the flexibility, are going to hinge back to left, right? That's not what I want you to do. Leave your upper body perpendicular to the surface of the floor, and then lift up only, if this is your range, that's fine. See if you can lift it just a little bit higher and down. It tests your balance as well as your strength. See, it's really, really tough, right? This is really challenging for me as well. So hold 1, 2, 3, and down. 1, 2, 3, and down. Ideally, if you can keep your knees straight, that will be best. And down. I'm just going to do it 2 more times for the purpose of this demonstration, and then you can hit pause and then do more if you like as you get stronger. So I'm going to repeat on the left side, and again, if you don't have enough balance for this, feel free to hold on to the wall. Lift up, 1, 2, 3, and down. 1, 2, 3, and down. 1, 2, 3, and down. I'm really feeling the burn. 1, 2, 3, and down. Last one. 1, 2, 3, and down. Good job. All right, this next one is going to be a hamstring stretch. So you're going to step your right foot forward, leave the heel on the floor, lift your toes up, and then you're going to slightly bend your left knee, and then you're going to hinge forward from your hips. You're going to feel a nice stretch on the back of your right leg, the whole length of leg, the whole length of the leg. And you're going to stay there with the chest open and breathe for 5, 4, 3, 2, and 1. And tap your toe down and then bring your toe back up for 5, 4, 3, 2, and 1. Tap your toe down and then come back up. We're going to repeat on the opposite side. Go ahead and step forward with your left foot, heel down, toes up, and then hinge forward from your hips. Bend your right knee, hinge forward from your hips, and breathe. You should feel a nice pull from the heel of your left foot all the way to the sit bone of your left hip. Breathe, chest open, for 5, 4, 3, 2, and 1. Tap your toe down and come right back up again for 5, 4, 3, 2, and 1. And gently come back up and step the left foot back. Last thing is I want you to interlace your hands behind your back like this. And keep your chest open, because most of us are so forward that I find that my patients, their shoulders are like, I don't know, oriented forward, right? They're so hunched forward. So feel your shoulders and make sure that they're not going forward. Pull them back, roll your shoulders back, and then interlace your hands behind your back. And every chance you get, I want you to just pull, interlace, and pull the arms back and up. And make sure you're not doing this and hunching forward, but really pulling back and lifting your arms up away from the floor, really getting a nice deep stretch through your pecs and the chest, and just your collarbones expand out like this. Any chance you get, that would be a good thing. Always being mindful of engaging your core. So that's it for today. Thanks for joining me.